Hello everyone, welcome to my channel Simplified Dentistry with Dr. Maheen K. And today our topic of discussion is oral candidiasis. So, oral candidiasis is also commonly known as oral thrush, and its causative organism is fungi, yeast, and it is of the genus Candida, right here. The genus is Candida. So, the multiple species are present of Candida, but of these the most common is Candida albicans, right? And the multiple species consist of mainly the two forms, the yeast form and the hyphae form. The yeast form is responsible for the transfer of infection from one body to another, right? And the hyphae form is basically responsible for invasion of the infection deep into the tissue, right? So, Candida albicans is basically the normal flora of many parts or systems of the body, like the mouth, the skin, the GI tract, mucosa, and the vagina. So, there's one thing that is a common characteristic of these parts of the body, that is, they all are moist and they are warm. So, Candida species will definitely grow in the environment that is warm and moist, right? And it is also an often opportunistic infection, and it can be transmitted by direct contact, for example, by kissing. Now we will be discussing the risk factors associated with oral candidiasis and oral thrush. So, what are the risk factors associated with oral candidiasis and oral thrush? First of all, we have immunosuppression. Immunosuppression is basically of two forms, that is the local form and the systemic form. What happens in the local form, this basically occurs in the area of the mouth, and in cases where patients are given corticosteroids, there is intake of corticosteroids usually by inhalation, and this occurs in patients with COPD and asthma. So COPD and asthma patients are usually taking corticosteroids, and there is a risk of increased fungal infection in these cases, especially when the immune system is not in check, or we can say that the immune system is suppressed. What happens in the systemic suppression is that it can be caused by systemic steroids, and again there is a risk of increased fungal infections and increased infections throughout the body, for example in patient with AIDS. So again, the patient who are immunocompromised, like in patients with AIDS, there is a chance that there is a systemic immune suppression, and this may lead to oral candidiasis or oral thrush. Then the second risk factor is extremes of age. So, what happens in extremes of age, for example, the young individuals, like the infants and the babies, right? Or old age patients, like old age patients whose immune system is again decreased. The immunity is decreased, right? So, this may also lead to oral candidiasis or oral thrush. The third risk factor is other comorbid conditions. Now, what are the other comorbid conditions? Like in patients with diabetes or smoking, this may lead to oral candidiasis or oral thrush. Patients with malnutrition, for example, vitamin deficiencies, right? That is iron deficiency, that may also lead to oral candidiasis, oral thrush. That's why we are often told to keep on taking our multivitamin to keep our immune system boosted, so that we are not at a risk of fungal infections. Then we have denture use patients. This is also very important because it occurs in patients with older populations. Usually patients who are older in age, they tend to be taking dentures in their oral cavity, and this may also lead to increased risk of fungal infections and thereby increased risk of oral thrush, right? So now coming to the pathogenesis. Pathogenesis of oral candidiasis or oral thrush, basically everything begins with dysfunctional immunity. So it basically starts only with the dysfunctional immunity. The body has to have a decreased immune response, or it has to have decreased immunity or some sort of suppression in the immune system, which may lead to overgrowth of candida, like in cases where there is moist and warm environment, like for example mouth, right? So dysfunctional host immunity will lead to overgrowth of candida in spaces of moist and warm environment, and this will form pseudomembranous adhesions on the tongue, which are very difficult but painless to remove, right? So the Candida albicans or Candida species forms these pseudomembranes on the tongue, which are very difficult to remove. Often, what happen is that these can only be removed by scraping method. The brush is supposed to be used in a scraping method so that it is finally removed from the tongue. Otherwise, normal motion would not let the pseudomembrane to detach from the tongue. Hence, it's very difficult to get candidiasis out of the tongue. All right. So now coming to the clinical features. Clinical features of oral candidiasis. Now, the first most important clinical feature of oral candidiasis is they are white, opaque, and patchy. Okay, they are patchy, like they may be in this form, and they are opaque, and they are very difficult to remove. They may be on the buccal mucosa or on the tongue. They may be on the buccal membrane or on the tongue. The plaque is very adherent, again, as I discussed before, that it is very adherent. The plaque is very adherent and it is very difficult to remove from the tongue, especially on the tongue, right? How does it clinically present? Now, there are various forms of oral candidiasis, and it may present clinically in different forms. First and foremost is pseudomembranous candidiasis. This is the most common one. Pseudomembranous candidiasis is the most common one, and it could be acute and it could be chronic. The tongue has a cottage cheese appearance. So, how does that cottage cheese appear? It's often patchy, and it is uh, very cheese like consistency, right? And there's a burning sensation, an unpleasant taste in the mouth, and it's common in elderly patients, newborns, and diabetic patients, and also in patients who have recently used antibiotics, right? So the first and most common form is pseudomembranous candidiasis. Again, it is acute and it's chronic. It could be any one of them, but it's the most common form, has a cottage cheese appearance, burning sensation, unpleasant taste in the mouth, common in patients with diabetes, either newborn, elderly, or antibiotics, patients who have recently taken antibiotics. So just to remember, we can say that they are present in patients with extremes of age, that is the newborn and the elderly. They may be, it may be present in patients with the comorbidities like diabetes, or patients who have recently taken antibiotics. Then coming to acute atrophic candidiasis. Acute atrophic candidiasis is again present in patients who have recently taken antibiotics, and due to that there may be a certain sort of burning sensation in the mouth. There's a loss of filiform papillae, radent ball tongue, and there's increased prevalence in patients with xerostomia, right? Increased prevalence in patients with xerostomia. So it can be common amongst the patient who have the disease of dry mouth, and the tongue may appear reddened, bald. There would be a loss of filiform papillae, and there would be burning sensation in the mouth, and they could also present with the recent use of antibiotics, right? central papillary atrophy, often known as median rhomboid glossitis, in which there is a well demarcated area of erythema or erythematous area in the median area of the tongue or in the midline of the tongue, right? This is the midline, and there is this erythema, and it is very well demarcated, also known as median rhomboid glossitis, is also a form of oral candidiasis or oral thrush, right? Then we have chronic hyperplastic candidiasis. Now this is the least common form, but it has a chronic plaque type. It is nodular candidiasis, hyperkerotic irremovable plaque type lesions on the anterior buccal mucosa, which are very difficult to differentiate from leukoplegia. So it basically looks very much alike leukoplegia. Then we have angular cheilitis. Angular cheilitis basically involves the angle of the mouth, right? So this is the mouth, and these areas are often affected by angular cheilitis, and there may be erythema on these areas, or there would be dryness, scaling, fissuring, right? And this may occur in patients with decreased video, right? Then we have denture stomatitis. Denture stomatitis again has a varying degree of erythema in the denture bearing areas where the patient is wearing the denture, and it may be due to any reason. It may be due to the improper design, right? Or it may be due to allergy to the denture base, right? Or due to inadequate curing of the ecleric, right? So this may all lead to denture stomatitis. So all these were the clinical presentations of oral candidiasis: central papillary atrophy, chronic hyperplastic candidiasis, angular cheilitis, and denture stomatitis. Other than these, we know acute atrophic candidiasis, and the most common form is pseudomembranous candidiasis. Now we will be discussing the diagnosis and the treatment plan of oral candidiasis or oral thrush. Okay, so finally we'll be discussing the diagnosis and the treatment plan of oral candidiasis or oral thrush, right? So the diagnosis, initially we can do the clinical diagnosis that can be based on the history, clinical examination, and assessing the risk factors. Then we'll come to the lab diagnosis. Lab diagnosis can be achieved by two methods, either by the wet film method, in which there is 10% potassium hydroxide preparation, and under the microscope there is a visualization of pseudohyphae budding yeast cells of Candida, or we can culture. In the SDA test we can see the creamy white smooth colonies, whereas in chroma agar we can see the green colonies, right? Then we come to the treatment plan of the oral candidiasis or oral thrush. Initially, we have the mild cases in which we can give the topical antifungals like clotrimazole torches or nystatin, right? Then we have the moderate to severe cases in which there are oral antifungals given like fluconazole. Or we have the refractory cases in which we give itraconazole, and in cases with the patients with inhaled corticosteroids, like in patients with COPD and asthma, we advise patient to rinse mouth regularly so as to avoid occurrence of oral candidiasis over and over again. So this is how we wrap oral candidiasis. I think we have touched all the topics. Hope you like the video. Please like, share, and subscribe to my channel, and hit the bell icon so that you never miss a video on my channel.